Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, my name is Gina Bertolini, and I'm a partner at K&L Gates in the Healthcare Practice Group. I'm joined today by John Lawrence, also a partner in K&L Gates' Healthcare Practice Group, and David Rybicki, a partner in K&L Gates' Investigation, Enforcement, and White Collar Practice Group. John and I are based out of Research Triangle Park, North Carolina, and David is based out of Washington, D.C. We join you today in this episode of Triage to discuss the significant increase that we've seen within the healthcare sector of cybersecurity threats posed by outside actors. And we'll address what to expect in the coming year and, importantly, how healthcare providers can protect themselves from these risks. Healthcare undoubtedly is one of the largest and fastest growing industries in the world. Certainly that's true here in the United States. And it is also one of the most heavily regulated sectors of the U.S. economy, in particular as it relates to the access and use of health information. Those who work in healthcare generally refer to health information as protected health information, or PHI, which is the legal term used by the primary federal regulatory framework for health information in the United States. And that's what most people know as HIPAA. That is the Health Insurance Portability and Accountability Act. And here in the U.S., even folks who do not work in the healthcare industry generally know that regulatory framework as HIPAA. HIPAA, of course, contains data privacy and security standards that govern the access, use, and exchange of PHI, in particular by healthcare providers, but also by third-party actors. And HIPAA really has driven health information confidentiality policy and procedure for the past 2 decades in the United States. When HIPAA was initially passed in the late 1990s, federal policymakers recognized the increase in the use of electronic media to access and transfer information. So HIPAA really was enacted as a way to ensure that federal standards would protect the exchange of sensitive patient health information through these newly emerging electronic channels. So fast forward 2.5 decades, and of course, we've moved into an almost completely electronic world, particularly as it relates to health information. So think about the last time that you saw a healthcare provider stand in an exam room with you with a paper chart and a pen that the healthcare provider was using to take notes. For many of our listeners, maybe that hasn't happened in their lifetimes. Those paper charts, as most of us know, have been replaced with laptops and internet-based electronic medical record systems, or even handheld devices or tablets. Healthcare providers are encouraged, and in fact, they are financially incentivized by the federal government in various programs through the Center for Medicare and Medicaid Services to adopt electronic medical record systems that will meet certain IT standards. In theory, as accuracy, access, and speed of information increases, so too will quality and timeliness of care. And in fact, the interoperability of health information will also drive down the cost of care. But as those things increase, in particular as interoperability increases, so too does the risk of breach. And that's what we'll focus on today. The Office for Civil Rights, also known as OCR, enforces HIPAA, including HIPAA's breach notification rule, which is part of the regulatory framework that makes up HIPAA's privacy and security rules. It's called the breach notification rule. OCR historically has been very busy enforcing these various rules. K&L Gates has assisted healthcare providers over the past 2 decades, as well as companies that contract with healthcare providers with breach investigations and complaints. Historically, we saw breaches caused primarily by user error, such as an employee who failed to implement proper security standards, or by accident, like a lost or a stolen laptop or a thumb drive with unencrypted PHI. We've also historically seen bad actors, but typically those are insiders, such as employees of the healthcare provider or the business associate health IT company that's providing services to the healthcare provider. And those are folks who are intentionally accessing PHI for personal or financial gain. Today, major threats to healthcare information privacy and security are very different. And if you pay attention to the news, you will know what I'm talking about. While the types of breaches that I just described still exist, we now see external threat actors far outpacing insiders as a source of healthcare data breaches. Since April of 2021, just a couple of months prior to this recording, the healthcare and the utility sectors have been the most targeted by ransomware threat actors. So the most targeted of all industries by these outside threat actors. And even within that high risk group, the healthcare sector is seeing the highest volume of ransomware attacks and other cybersecurity attacks. So I'd like to turn to David Rybicki first with our initial questions. David, can you help us understand what does the current threat landscape look like for healthcare providers?
Sure, Gina. That landscape has changed substantially and become far more dangerous since the onset of the COVID-19 pandemic in 2020. And although the healthcare sector, as you've observed, has been a primary target of cybersecurity threat actors, COVID exacerbated what was largely a pre-existing lack of adequate cybersecurity measures throughout the healthcare industry. The fact is that many small and mid-sized healthcare entities just don't have the resources to keep up with the security requirements that are necessitated by the very valuable information that they create or maintain. And they are increasingly seen as prime targets for threat actors because of the abundance of PHI that is available via digital platforms and its relatively high value on the dark web. So healthcare entities are really attractive targets for malicious actors. You mentioned ransomware. In 2020, ransomware became perhaps the most formidable emerging cybersecurity threat for healthcare. And it caused almost half of all of the malware-related breaches targeting the sector, costing healthcare entities in the U.S. over $20 billion just in 2020 alone during COVID. And we saw just a few months ago, towards the end of 2020, the U.S. Cybersecurity and Infrastructure Security Agency and FBI and HHS all issued advisories on a ransomware warning due to the increased and really imminent cybercrime threats to specifically hospitals and, as you mentioned, providers. We also see historically other threat vectors became more prominent during COVID, like business email compromise and phishing schemes. A lot of those took on COVID-related angles during the pandemic. You mentioned insider threats. That's taking a disproportionately large role in the healthcare space, but it's a smaller role compared to BEC and ransomware. And then finally, I think worth mentioning is the Internet of Medical Things, which is really exploding in the United States. There's over 100 million connected devices right now, and all of those devices are potentially vulnerable to cyber attack. So we're seeing a lot of increased trends towards incursions in the IoMT space as well.
Yeah. And, for our listeners, when outside actors access PHI, even if they're just decrypting it so that it's unusable by a healthcare provider, or if they're moving within a healthcare provider system where they can access PHI, most likely that's going to result in a breach of PHI under HIPAA's breach notification rule. Of course, covered entities are always going to evaluate all of the facts and circumstances, and there's a test that they would use under the breach notification rule to determine whether, in fact, PHI has been compromised. But it's going to be hard to say where PHI has actually been accessed by outside actors for impermissible purposes, that's not a breach under the breach notification rule. Again, it's always based on facts and circumstances. And that's going to require, reporting to OCR, states attorneys generals, the affected patients. So, John, I'm wondering if you can talk understanding the significant implications for healthcare providers when these kinds of attacks occur. How can providers prevent and mitigate security incidents and PHI-related breaches? What should providers keep in mind?
Thanks, Gina. Yeah. As you and David have highlighted really well, the threat of cyber intrusions in healthcare is very complex, and so how specific providers can best mitigate security incidents and PHI-related breaches is highly variable between providers and their specific context. But generally, the threshold step in preventing and mitigating security incidents and PHI-related breaches typically requires conducting a risk analysis that identifies and implements safeguards that carry out the security rule standards and implementation specifications. And so the risk analysis generally should be an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of PHI held by the covered entity or, as the case may be, the business associate. And according to HHS, a risk analysis is considered foundational to an entity or provider's compliance with the security rule and the overall protection of PHI. And providers and their business associates should conduct an initial risk analysis and thereafter periodically repeat risk analyses as technology develops, as the amount and type of PHI might change, and as other circumstances can evolve, and certainly when threats are detected. OCR does issue annual guidance on the security rule and has consistently explained that the risk analysis is not one size fits all for providers and does not necessarily guarantee compliance with the security rule. Instead, OCR maintains that each risk analysis must be tailored to the characteristics of the organization at issue and its environment. And accordingly, covered entities and business associates should regularly review their size and complexity, their volume of PHI, as we mentioned, and their technical capabilities as well. And because these factors can rapidly change, as we mentioned, it just requires constant review by providers. But generally, OCR does give general considerations for providers to examine. Those include assessing current security measures, determining the likelihood that a threat occurs, determine the potential impact of the threat occurrence, and then also determine the level of risk. And providers ultimately should obviously pay very close attention to OCR's guidance. OCR does unpack those very general parameters that could be applicable for each provider.
Great. Thank you, John. I will say I visit OCR's website regularly. I review, FAQs and other guidance, and there are a lot of very good resources for healthcare providers through the OCR website. David, John just talked about security risk assessment under HIPAA's security rule and other steps that providers can take to mitigate security incidents. We also know that it's important for providers to have robust compliance programs. And I'm wondering if you can talk about developments that require healthcare entities to modify those compliance programs, or any indication of how OCR's expectations have changed with respect to compliance with the security rule and other aspects of HIPAA's privacy and security requirements.
Absolutely, Gina. We've been talking about ransomware, and it's certainly been in the news on many fronts lately, including the payments of ransom to get the data back. And that is definitely a common approach taken by ransomware victims, both in and out of the healthcare sector. But recently, both the FBI and OCR have actually recommended against paying ransoms. And there's definitely now increased compliance risk associated with those payments, given recent guidance that was issued by Treasury's Office of Foreign Assets Control, OFAC. And that OFAC guidance basically says that healthcare providers who pay ransoms can run afoul of the U.S. sanctions laws if they make those payments to, for example, certain cyber criminals who are sanctioned, who are listed, or otherwise have a nexus to a sanctioned entity. And an example of this was the 2017 WannaCry attack. This was the first ransomware attack that widely targeted vulnerabilities found in those medical devices that I mentioned a few minutes ago. And it's believed to have been sponsored or have some kind of nexus to North Korea. It was not possibly self-evident prior to WannaCry and this guidance, but healthcare entities now need to think about OFAC compliance when they're looking at HIPAA-protected information.
Right. So I'd like to build on what you just said and go back to John and ask what providers should consider when responding to a security incident or a potential breach of PHI. We just heard David talk about OFAC's guidance and what is now required. And I agree with you, David. I think that's new for healthcare providers to be thinking about that guidance and what they need to do. John, building on that, what else should healthcare providers be thinking about when they're faced with an incident like those we've discussed today?
So certainly a really critical question, and just how to best mitigate against a potential breach will vary by provider and the PHI at issue and just the general context in which the breach or the mitigation occurs. So too will the type of response vary to a breach because of those factors. So in general, to respond effectively to a security incident and potential breach, covered entities and business associates should have a clear security incident procedure plan and response plan, as well as a plan for reporting a potential incident. The security incident response plan should outline steps to take when a security incident occurs or is suspected, and an entity's workforce should be adequately trained regarding how to identify a security incident, including understanding early indications of a ransomware attack, for example, or common business email compromise or phishing schemes, and how and to whom to report the security incident or breach of PHI. And entities should also have a data backup plan that creates and maintains retrievable exact copies of PHI, a disaster recovery plan that includes procedures to restore the loss of data, and an emergency mode of operation plan that includes procedures to enable the continuation of critical business processes. And of course, that's important if the security incident potentially disrupts operations, particularly critical operations. And also I'd add that entities should periodically test and revise contingency and emergency response plans, and should also periodically reevaluate policies and procedures to confirm that they continue to meet privacy and security requirements. And in particular, when a covered entity or a business associate becomes aware of a potential security incident, it's critical to respond in an organized, focused, and prompt manner. And often this entails examining things like the genesis of the suspected incident, the type and nature of the incident, the duration of the incident, and whether it's ongoing, the extent of the incident, including affected data types and systems, whether a breach of PHI actually did occur, and if so, the identities of affected individuals, which may include workforce members and patients, and the necessary steps to stop the incident, obviously, if it's ongoing, and resecure the affected information systems. And as soon as the incident or breach is discovered, the entity should consult legal counsel to determine whether the incident must be reported, to whom, to what extent, and within what time frame. And obviously part of this is making sure that the provider is complying with the breach notification rule. And again, as I mentioned a moment ago, these processes and what this actually looks like is going to be highly variable across entities, across providers, given the type of PHI, the type of breach at issue. But in general, those are things that providers need to consider.
Great. Thank you, John. I think that is really tremendous advice. As you know, we've represented a lot of healthcare providers dealing with HIPAA breaches, and we've worked with OCR, and we know that OCR doesn't expect that there will be no breaches. OCR does expect that healthcare providers will prepare and respond appropriately when a breach occurs. And everything you talked about are really important steps to preparing for and then appropriately responding. And certainly healthcare providers want to be thinking about that before a breach occurs, not after. We greatly appreciate you joining us today for this episode of Triage. David, John, and I are available for additional ongoing discussions on this issue, and certainly if you need advice or guidance, and our information is available through K&L Gates' website. Thank you very much.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.